All right, welcome to the Behavioral Health and Safety Policy for Florida Session 2022. This is where I'm just going to give you a digest of what's coming before the Florida legislators up in Tallahassee this month and next month. That's it. Our session in Florida is just 2 short months, and we do a lot in that time. And so in order for you to be your best selves and to advocate for your clients' best, here's some bills that are of interest. You're really lucky. We have a wonderful partner here at Live Tampa Bay in the Organization of Drug-Free America. They track legislation here and in other states, and they've done a breakdown for us. We're going to focus right now on anti-drug treatment and harm reduction bills because that falls within the scope of what our coalition focuses on and has chosen to focus on. And so, like I said, these are things that are, that have been voted on by our leaders here in the Tampa Bay for areas that they want to focus on moving forward for 2025. So that's anti-drug bills, treatment, and harm reduction bills. So the first bill that we're going to talk about is actually an appropriations bill. Is a substantive bill. And it is, the sponsors are Senator Chev Jones and Representative Andrew Learned. And this bill seeks to exempt fentanyl test strips from the drug paraphernalia law. These bills were filed as what's called repealer bills, where they just X words out of the statute. However, after consulting with the Sheriff's Association, they decided to narrow the scope down to just drug tests for fentanyl and fentanyl analogs. And that would cover the deadly drugs that are out on the street that are adulterated into other substances and killing folks unknowingly. And right now, both of these bills are in the are primed to go into their criminal justice committee. But they haven't been in that committee yet. I have listed some of the criminal justice leadership in the Senate on the top side and then in the House on the bottom side. And those are the folks who set the agenda for that committee. If you see the pathway to the floor, it has to go to criminal justice first, then judiciary, then rules, then finally the Senate floor or the floor of the House. You'll see that for each and every bill. The next bill is our favorite bill. It's been up before. It's to expand who gets to become peer support specialists. It also specifies certain trainings and other things. This bill is being brought forward again this year by Senator Rouson, and Representative Fetterhoff has it in the House. This, like I said, is a bill that is a perennial bill. We like it. I'm really hoping that it gets across. I'm hoping that it gets across the finish line this year. It is in Appropriations, which is the last stop before the Senate floor in the Senate, but it has 2 stops left before it gets to the floor of the House. HB 4255 is an appropriations bill. This is actually a bill to fund an anti-stigma campaign in the Tampa Bay region in our 8 county areas that would roll out a pilot project. This anti-stigma campaign is actually evidence-based. It has been proven to work in other areas, and we would be the first area in Florida that they would launch this initiative. And if it works in the Tampa Bay region, it would expand beyond our region to the entire state. It is really steeped, this anti-stigma campaign and their research is steeped in storytelling. And so it's about telling people stories of recovery and getting those stories into communities that look and feel like the folks that are telling those stories. So I might have a story, Senator Rouson might have a story, who else? There's a lot that Kirkpatrick, one of our stakeholder leaders, might have a story. Our stories are all different. They would all resonate with people in slightly different ways. And in that resonation, we then reduce the stigma. And so it has already passed the Healthcare Appropriations Subcommittee and is on the way to the General Appropriations Committee in the House. And of course, our own Representative Jackie Toledo has that bill. She's from Hillsborough County. HB 731, SB 544 is a bill that will actually expand the who can administer Narcan. It would help to get life-saving interventions like Narcan, and I think it might even include Tera bags or pill emulsifier kits. Expand those into pharmacies so that pharmacists, that they're giving out opioids, they're also giving out Narcan, they're also giving out these the Tera type bags. And it highlights the fact that civilian personnel can administer emergency opioid antagonists, or simply Narcan. So that civilian personnel and law enforcement agencies can administer Narcan, that pharmacies can order certain emergency Narcan deployments, and it's moving right along. Senator Boyd has it, and has it in the Senate. Representative Caruso from South Florida has it over in the House. Representative Caruso carries a lot of this type of policy. His son, he has a personal connection to it, and he's always a very good champion. It looks like I said, it's only got a couple of more stops before it reaches the floor of both the House and the Senate. And we can look forward to benefiting from more people being able to deploy Narcan. Representative Coster and Senator Gruder have an interesting bill. This revises the licensing requirements for social workers, marriage and family therapists, and mental health counselors, and other folks in the mental health or behavioral health sector. I am very curious what folks in the field think of this bill, because it really does. It's about like changing certification, changing requirements. It seems like the impetus, and from talking to Senator Gruder's, the impetus behind this was to get more people in the field quicker, to be able to see all of the patients. It's no secret that we have a dearth of behavioral health experts or mental health providers in Florida, in our region specifically. And so how do we meet the need? Well, we need more people in the field doing these jobs, and this is one of those solutions. It is just a few stops from the floor of both the House and the Senate, but definitely look that over. This PowerPoint has hyperlinks. The bills are hyperlinked, so you can click on them, and it will take you directly to either myfloridahouse.gov for the House bill, or the Florida Senate for the Senate bill. All right, Representative Plankin and Senator Bruder have the anti-drug bill, and this is the bill that revamps what the definition of murder is to include distributing an illicit substance that is proven to have caused or is proven to have been a substantial factor in producing the death of the user. It also expands what I call the drug-free zones. Those are the zones like around schools, around nursing home, and other areas where you have heightened penalties for distributing drugs. And so the new zones would also include, not being able to sell, or heightened penalties for selling drugs 1,000 feet from a mental health facility, a healthcare facility which provides substance abuse treatment, a facility providing services that include clinical treatment, intervention or prevention, and recovery residences. And there's statutory definitions for each of those things. That's why there's those 3 dots. I just didn't want to bury you down with details, but if you want to get into the nitty-gritty, you can follow the link at the top of the page and find out more about what's included in here. And it finally sets legal penalties for persons who violate the paragraph, such as felony of the 1st degree with punishment provisions. This looks like it's going to pass it's on the way to, it's already primed to go to the floor of the House, and is only 2 committees away from the Senate floor. The Sheriff's Association is behind it. Sheriff Lima is one of the major forces behind this bill. He's from Seminole County. And so that is moving along.